How do income limits impact Medicaid eligibility for parents? Have you ever wondered how income limits affect whether parents can access Medicaid? Understanding this can be really important for families, especially those with disabilities. Medicaid is a government health insurance program that helps many families, but income limits play a big role in who qualifies. First, let's talk about what these income limits are. They set the maximum income a family can earn to still be eligible for Medicaid. These limits can vary quite a bit depending on where you live and how many people are in your family. Typically, they are based on a percentage of the federal poverty level, which is updated every year. When assessing eligibility, Medicaid uses a calculation called Modified Adjusted Gross Income. This includes wages, salaries, and other taxable income but may leave out some deductions. States apply income limits to this amount after accounting for allowable deductions. For parents, these income limits are often lower than for other groups like children or pregnant women. In some states, the income limits for parents can be as low as 20% to 50% of the federal poverty level. This means that if a family earns more than this threshold, they may not qualify for Medicaid. This can be tough for disabled parents or those parenting with disabilities who might have limited earning capacity but still earn above these low limits. Family size is also a factor. The more people in a household, the higher the income limit. This is because larger families generally need more income to cover their basic needs. However, even with this adjustment, many disabled parents find themselves just above the income limit, making them ineligible for Medicaid even when they truly need it. Some states offer additional options for parents who exceed these income limits. For example, medically needy programs allow individuals with high medical expenses to spend down their income to qualify. There are also special trusts, like Miller or Qualified Income Trusts, that can help manage income and assets to meet eligibility criteria. Medicaid buy-in programs for working disabled parents allow for higher income limits in exchange for premium payments. Understanding how these income limits work is essential for disabled parents looking for Medicaid coverage. It impacts access to health care and support services that help them parent effectively. It also influences financial planning and decisions about work and income. For practical steps, disabled parents should carefully calculate their household income, including all sources, to see if they qualify. They should also look into state-specific income limits and exceptions, as these can vary widely. Seeking help from Medicaid planners or advocates who understand disability and family situations can be beneficial. Additionally, considering programs designed for parents with disabilities or children with special needs may provide options with higher income limits or different eligibility rules. Income limits significantly influence Medicaid eligibility for parents by establishing income thresholds based on family size and state rules. For disabled parents, these limits can be restrictive. However, knowing the rules and available options can help secure the coverage and support needed for inclusive family lives.